Are you a Covidiot? If so, fret not. Your generous and loving government is here to help. After covering these 5 simple questions, you will no longer hold the shameful title of Covidiot, but instead be known as a Covidal. What is COVID-19? COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. Most people infected experience mild to moderate respiratory illness and recover fully in a matter of days. Current population data shows a total crude mortality rate of 0.28 and 0.09 for those under the age of 65, with less than 5% of cases leading to hospitalization. That is 1 death in 1,166. Comparatively, your odds of dying in a car accident are 1 in 107.
This is the worst disease known to mankind. Hospitals all over the world are overflowing with COVID patients because half of the United States refuses to trust our beloved omnipotent savior, the science.
Where did COVID-19 come from? COVID-19 was produced in the Wuhan Institute of Virology by scientists performing viral gain-of-function research funded by the National Institutes of Health at the behest of Anthony Fauci.
COVID was spawned when a Chinaman ate a bat and fucked a pangolin.
How can COVID-19 be treated? Effective treatments range from proper diet, exercise, azithromycin, monoclonal antibodies, and ivermectin.
Ivermectin is horse dewormer. There are no available treatments for COVID, and prescribers that say otherwise should be fired and have their medical license revoked.
What is a vaccine? A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease, and is often made from inactivated or attenuated forms of the microbius, toxins, or one of its surface proteins.
A vaccine provides protection to a particular infectious disease.
Is the COVID-19 vaccine safe and effective? The Food and Drug Administration approved the Pfizer vaccine after evaluating 2 clinical trials, both funded by Pfizer. The first was Study BNT162-01. It was a phase 2-part dose escalation trial that enrolled a total of 96 patients. The study was meant to determine if there were any immediate dangers to taking the vaccine. The second study was C459001. It is a phase 1, 2, and 3 multicenter multinational randomized placebo-controlled double-blinded candidate selection and efficacy study. It has enrolled 44,000 participants and is currently ongoing. However, after the first few months of the trial, the patients were unblinded. Typical vaccine side effects were observed within a week of the 2 administered doses. This was good news. However, we are now seeing some post-marketing anomalies. According to this second study, the vaccine is 95% effective at preventing infection of COVID-19 within 7 days of the second dose. But a recent study from Israel has found the vaccine to be only 39% effective overall. And according to the Pfizer-BioNTech FAQ page, while the vaccine may not prevent infection symptoms or transmission of the virus person to person, it is effective in preventing hospitalization and death.
Do not believe your lying eyes. The FDA has approved the Pfizer COVID vaccine as safe and effective based on the science.
Congratulations! You are now no longer a Covidiot.